Well, we are at the top of the hour, and so we're going to go ahead and get started. Good morning for those of you on the Pacific time zone, like myself, and good afternoon for everyone else. We're so excited to have you here. Thank you all for joining us for our joint presentation brought to you by the Mental Health Technology Transfer Center Network and the Center of Excellence for Protected Health Information. Today, we're covering federal health privacy laws, basics for school professionals. This is session 1 of our 2-part series. My name is Jessica Gonzalez, and I'm the Associate Director for the MHTTC Network. And again, we're really excited to have you here for the first session of a 2-part virtual learning series, with session 2 being held on Thursday at the same time. We hope that you all join us on Thursday as well. Let's go ahead and get started with some Zoom features and logistics. On the next slide here, you'll see that we have listed some of these features, but just to let you all know, all attendees are muted and cannot share video. We do have closed captioning available. Please click the CC button on the bottom of your screen for options. If you have a question for the presenters, we ask you to please use the Q&A pod. We want you to use the Q&A pod so that our presenters are able to see the questions that are piling in throughout the session. But if you have audio or tech issues or relevant resources to share with other participants of the session, use the chat box. We have that enabled for you all today. And just a reminder that we are recording today's session. You will receive an email within a week from today's session with access to the recording, the slide deck, and information about how to obtain your certificate of attendance. Again, for those who just joined us, this webinar is being recorded. We're going to send you a copy of the PowerPoint slides and a link to the recording within a week. By joining the session, you are automatically giving consent to the recording and to note-taking. I also just want to note that this is a safe space. Please feel free to openly share your opinions via the chat box. We want to hear from everyone. And I mentioned earlier, this is brought to you by a collaboration from the Center of Excellence for Protected Health Information and the MHTTC Network. The COE-PHI is funded by SAMHSA to assist people and organizations in understanding and applying current federal health privacy laws and regulations on the job and specific to their task or role, and to also assist patients and their loved ones in knowing what their privacy rights are when seeking and receiving treatment for substance use and mental health. Resources, training, and technical assistance provided by the Center of Excellence for Protected Health Information does not constitute legal advice. Please also note that today's presentation will cover only the federal health privacy laws and their application to student records, as it is not within the scope of the COE-PHI to address individual state privacy laws. And a little bit about the MHTTC network. For those of you who are working with us for the first time, we are also funded by SAMHSA. We include 10 regional centers, a National American Indian and Alaska Native Center, a National Hispanic and Latino Center, and a network coordinating office. Our network supports resource development and dissemination, training and technical assistance, and workforce development for the mental health field. We're bringing this learning session to you today through our MHTTC School Mental Health Initiative, where we aim to bring awareness, disseminate information, and provide technical assistance and training on the implementation of mental health services in schools and school systems. We'll make sure to enter the links to the MHTTC website, as well as the COE-PHI website in the chat box so that you can learn a little bit more about our work and our resources that are available to you free of cost. Now, just want to give a quick overview of our learning objectives before I pass it on to one of our amazing presenters for today. Today, we aim to describe how federal health privacy laws, such as HIPAA and FERPA, apply to student mental health information. We will also explain how student mental health information can be protected and shared in compliance with federal health privacy laws. We will also discuss common scenarios involving student mental health information that arise in school settings through case study discussions led by our clinical and legal experts. and demonstrate how relevant resources and technical assistance can be accessed through the MHTTC network and the Center of Excellence for Protected Health Information. I want to remind everyone that we do have our Q&A pod open for any questions you have throughout the learning session, but I do also want to notify you that we have over 1,000 participants in this learning session right now. And so given our time constraints and the large number of attendees today, we will not be able to address all questions, but we will try to get through as many as possible. And now, without further ado, I just want to give a quick introduction to our amazing presenters for today. Our team and presenters include Dr. Stephen Adelsheim from the MHTTC network at Stanford University. We also have Amber Black, and Amber is also from the Center of Excellence for Protected Health Information. We also have Abigail English, who comes to us from the National Center for Youth Law. We're so excited to have everyone here with us, and I'm happy to pass it over to Dr. Steve Adelsheim, who will get us started today.
Thanks so much, Jessica, and thanks to all of you for being here for this wonderful opportunity to share this important information. So as a reminder, why this is important is that privacy regulations protect your students, and they're very important for helping you understand what the boundaries are in terms of sharing information about students and their families. Next slide, please. So, as a clinician, for all of us, obviously, our first priority is the safety and well-being of all of our students. It seems important to realize as we're having these initial conversations with our students that often this is their first experience with a mental health system of any type, and we want to be sure that we're creating a strong and trusting relationship that is built on support, but also with the idea that if this is successful, it allows for positive thoughts about any potential interface with the mental health system in the future, which can be very important down the road. So it's really critical that we be able to talk about the realities of our communication with our students, with caregivers, with schools, in a really honest and direct way, and that we understand those aspects really well. We're going to move into a poll right now, so let's have the first question. If you could share with us in the poll, have students using your services expressed concern about their information being disclosed to their parents or to their caregivers? You should see the poll jump out there in front of you. We're going to give you a little bit of time, and boy, these numbers are jumping up really quickly. So what we're seeing is that so far, 80% of you are saying yes. This has been 79%, 14% no, 7% not sure. So clearly, this is a really critical issue for us to have a good sense for and to know how to do this communication with caregivers in appropriate ways. If we go to the next question, poll number 2. So have students using your services expressed concerns about their information being disclosed to other individuals in the school setting? Let us know what your sense has been about that as well. We're going to give just a little bit of time for folks to answer that question. And it looks like maybe the numbers are a little bit less. When we look at those results, 69% of you say that that's been an issue, maybe 24% not as much. So both are major issues, and depending upon who actually we work for too, these issues are going to be really important, and that's part of what we want to touch on over these next 2 sessions as well. So thank you for that. So at this point, let me hand things off to Abigail then to keep us moving.
Thank you, Steve, and thank you, Jessica, and thank you to all the participants who have joined us today. This is just a fantastic turnout. I want to start by saying just a few things about what the underlying rationale is for these laws that protect confidentiality. And a leading reason is to avoid negative health outcomes. We want to protect the health of adolescents, and we want to protect the public health. And to do that, we need to encourage adolescents to seek health care that they need, including mental health care. And these points are supported by decades of research findings. Next slide. So what the research has shown us over, at least 40, 50 years is that many adolescents do have privacy concerns. And those privacy concerns are related to a wide range of different issues, but primarily we've found that adolescents are primarily concerned about disclosure of information, particularly to their parents, not exclusively to their parents, as we saw from the second poll, related to sexual behaviors, substance use, and mental health concerns. And of course, mental health concerns are a major focus of today's presentation and Thursday's presentations. Next slide. So another thing that we have found from the research findings is that privacy concerns have a very significant effect on the behavior of adolescents. It can, concern about privacy can influence whether they seek care at all. The AdHealth study that was started at UNC found that there was a lot of foregone care due to privacy concerns. Privacy concerns influence when adolescents seek care and sometimes cause them to delay significantly in seeking the care that they need. It also influences where they seek care. So it may determine whether they talk to a school mental health professional, a mental health professional in a school-based health centers, or whether they go to some other community-based provider. And also privacy concerns influence how openly adolescents talk with their healthcare provider. And that, of course, is a really critical issue in making sure that they get the care that they need. Next slide. So now with that background and with the background of the poll questions that Steve led us through, we're going to turn to an overview of several of the federal privacy laws that are relevant for mental health services in school settings. And we're going to talk a little bit about FERPA. We're going to talk a little bit about HIPAA, the privacy rule. We're going to talk about Part 2, substance use disorders, and we're going to have a quick look at the 21st Century Cures Act. So I'm going to start us off talking about the Family Educational Rights and Privacy Act, which I imagine is familiar to many of you, at least to some degree, and it's commonly referred to as FERPA. Next slide. So the leading purpose of FERPA, which has been on the books for many years, is to protect the privacy of educational records and also to assure access to records by parents and by eligible students. Eligible students are those who are 18 years old or older, which in almost every state means that they are adults, or are students in a post-secondary educational setting. We're focusing today primarily on the K through 12 and even the adolescent age group in that. Next slide, please. So what is it that FERPA protects? FERPA protects what are referred to as education records. And education records may be in multiple different forms. They are records, files, or other documents which can contain information directly related to an identifiable student. And they are records which are maintained by an educational agency or an educational institution or by a person acting for such an agency or institution. So education records are really very broad in their scope and could implicate a lot of different kinds of written information that are contained at schools or held by a person acting for schools or educational agencies. Next slide, please. So a big question that frequently arises is, do education records contain health information? And that's of concern to both students, but also to providers who are offering services to health-related services to students in school settings. And education records may include certain health information. For example, they may include the records that are maintained by a school nurse. They include a student's IEP, individualized education plan, and other special education records that are maintained by the school, even though these records are also subject to specific IDEA confidentiality rules. So one of the things we're going to see throughout the presentation today is that often more than one federal privacy law applies to the same information or the same records. And that's the case with IEPs and records that are subject to the IDEA. In addition, immunization records that are in a school file are part of education records. However, there are other records that are not necessarily, that do contain health information and are at a school, but they, or are about students, but they do not constitute or are not considered education records. And these are ones that are called treatment records that pertain to students 18 years old or older, and that are maintained by specific healthcare professionals such as physicians, psychiatrists, psychologists, or other paraprofessionals, and they're available only to the persons who are providing the treatment. Next slide, please. So if there are education records, who is it that has access to them? Well, primarily parents and persons who are sort of legally in the shoes of parents must be allowed to review and inspect records on request. Access to education records by anybody who is not a parent is generally restricted unless the parent gives consent, or in the case of an eligible student, age 18 or older, the eligible student gives consent. And there are, of course, exceptions to that, which we'll look at in a moment. And as I had said, an eligible student is one who is age 18 or older or enrolled in post-secondary educational institutions. And that eligible student has access to and control over their own records. Now, one of the important things to remember is that both with FERPA and with HIPAA, which we'll talk about in a little while, there's often the thought that these access rules or these privacy laws prevent the sharing of information. And the reality is that information can be shared as long as one has the consent or the permission of the appropriate person. In the case of these education records, the parent or the eligible student. Next slide, please. So what are the exceptions that allow access to information in education records without the consent of the parent or the eligible student? Well, there are definitely circumstances in which they can be released to other school employees, not necessarily every school employee, but certain school employees. Directory information can be released, and certain information in records can be released in a health or safety emergency and in instances that require reporting of child abuse. And of course, the child abuse reporting could be a whole other webinar, because child abuse reporting varies from state to state and is quite complicated. But that is one of the exceptions when education records can be released without the consent of the parent or the eligible student. Next slide, please. So we're going to do another poll question here. this is a true or false question. FERPA only protects written records and does not apply to information received verbally or to mental recollections. Is that true or false? I think you have just a few more seconds. So 36% said that this was true and 64% that says that this was false. So let's look at the next slide. It was true. FERPA only applies to written records. Information received verbally may be protected by other privacy laws or by a provider's professional ethical duty of confidentiality. So that's really an important point to remember, because there is a difference between federal privacy laws in terms of what information they protect. And now we're going to turn to Amber, and she's going to talk with us about the HIPAA privacy rule.
Thanks, Abigail. Hi, everyone. As Abigail said, I will be reviewing the HIPAA privacy rule, which many of you may already be familiar with, but it's always good to have an overview. So next slide, please. So the HIPAA privacy rule covers protected health information, which is health information that is individually identifiable and is created or received by a covered entity, the definition of which we will review on the next slide. But it's important to note that education records that are covered by FERPA are explicitly excluded from the definition of protected health information in the HIPAA privacy rule. So if an education record is covered by FERPA, HIPAA does not apply. Next slide. The HIPAA privacy rule does apply to the covered entities I referenced, which include health plans, healthcare clearinghouses, and healthcare providers. So that means many healthcare or mental health professionals and sites that care for adolescents will be covered by HIPAA, but not necessarily those who provide services in schools. Next slide. So in order to determine whether HIPAA applies to the school setting, you'll have to ask whether the professional or entity in question furnishes, bills, or receives payment for healthcare in the normal course of business, whether they conduct covered transactions and transmit those electronically. And the Center for Medicare and Medicaid Services website has a decision tool that can help you to make that determination. And once you have determined that the HIPAA privacy rule does apply, you should know that it affords several rights to both the individual and sometimes the parent. So the individual always has access to their information or protected health information, and they have some control over the disclosure of their PHI, and they may also request certain privacy protections for that information. Parents are generally considered personal representatives of their minor children, and the personal representative also has access to the individual's protected health information. When it comes to disclosing PHI to others, disclosure without authorization is permitted for treatment, payment, and healthcare operations. And there are some other exceptions you'll see listed there, but to anyone else, generally disclosure is required. And you should ask yourself whether the authorization of the parent is required for that disclosure or the authorization of the minor is required. And in order to make that determination, you will use the information that Abigail will share with you shortly.
Thank you, Amber. That was a great overview of HIPAA. I always say HIPAA is sort of the elephant in the room, and we could spend all day, going over the finer points, but that was a great overview. Thank you. One of the things that it's really important to understand about the HIPAA privacy rule is when does it treat adolescents who are minors, who are under the age of 18 generally, as individuals, and you could put quotes around that. So let's look at the next slide. This is a little bit complicated. As you know, the final HIPAA privacy rule came out in, I think it was 2002. So it's been on the books for a couple of decades, and people still have questions about this aspect. So minors are treated as individuals under the HIPAA privacy rule in 3 specific situations. And the first one is the most common. And that is when the minor has the right to consent to whatever healthcare is involved and has consented to that healthcare. The second one is that the minor is allowed to obtain care without parental consent, and somebody, the minor, him or herself, a court, or somebody else has consented to the care. And the third one is that parents have agreed to sort of confidentiality between the minor and the healthcare provider. So if a student's parent has agreed that confidential communications can take place between a healthcare professional and that student or that young person, then that has legal significance under the HIPAA privacy rule. And the legal significance means that minors who are acting as the individual can exercise rights to protected health information. And Amber had outlined what some of those rights were. The big question that people often have is, does that also mean that minors who are considered the individual, control disclosure of their protected health information to their parents? So this is important because generally, as Amber explained, under the HIPAA privacy rule, parents are considered the personal representative of their minor children, which means they would generally have access to their protected health information. However, when the minor is the individual, the HIPAA privacy rule defers to other laws, specifically to other state laws or to other federal privacy laws, to determine whether parents have access to the information. And if state or other laws require disclosure to parents, the provider has to disclose. If state or other law prohibits disclosure to parents, or at least prohibits it without the permission of the minor, the provider may not disclose. If disclosure is permitted, then if the law is silent, then the provider has discretion. And I know this is a little bit of a complicated formula, but it is an important one and has a lot of implications for when parents have access to protected health information under the HIPAA privacy rule, when their adolescent minor is allowed to consent to their own care. Next slide, please. There is also an exception in cases of abuse or neglect or endangerment, where the provider can choose not to treat the minor's parent as their personal representative and therefore not automatically grant them access to the protected health information if they have a reasonable belief that the minor has been or might be subjected to domestic violence, abuse, or neglect by the parent, or if treating the parent as the personal representative and giving them access to the protected health information might endanger the minor. And in the provider's judgment, it's not in the best interest to treat the parent as the personal representative, and there's no other law to the contrary. So again, slightly complex rule here, but a very important one to remember. Next slide. This slide is here not because we're going to talk about the state laws today, but because the HIPAA privacy rule does defer to these laws in determining when parents may have access to their minor child's protected health information when these laws allow the minors to consent to their own care. And every state has some of these laws that are either based on the minor's status, for example, if they're homeless or they're a parent, or based on a specific service such as STI or HIV care, outpatient mental health, or substance abuse services. And some of these minor consent laws also contain specific confidentiality or disclosure provisions. So that needs to be taken into consideration in figuring out how the HIPAA privacy rule itself applies. Next slide. So our next poll question, again, a true or false question. Parents always have access to their adolescent child's health information under HIPAA. Is this true or is this false? And you'll have a few seconds to respond. So 11 of you said that this is true, and 11% said it's true, and 89% said it's false. That is the correct answer. It is false. Parents do not always have, and we can look at the next slide to see the correct answer. HIPAA does, as we explained, defer to state and other laws that determine parents' access when an adolescent minor is allowed to consent for their own care, and may also limit parents' access in situations involving abuse or endangerment. Next slide. So the last issue we're going to address related to the HIPAA privacy rule and FERPA are, how do we figure out whether HIPAA or FERPA applies? And that's not always a very clear-cut or easy question. Next slide. So a few of the questions that need to be considered in determining whether a student's mental health records are governed by HIPAA or by FERPA are: who is providing the service? Is the information protected health information? Is the information part of an education record? Is the information part of a treatment record? So as we saw, treatment records are not part of the education record. So treatment records might be governed by the HIPAA privacy rule if the other criteria were satisfied. If information is part of an education record, then it is not considered protected health information under the HIPAA privacy rule. And if it's not an education record, it may be protected health information if it falls under the other criteria for the HIPAA privacy rule, one of which has to do with who is providing the service. In other words, is the person or entity providing the service a covered entity under the HIPAA privacy rule? Next slide, please. So again, are school-based health center records HIPAA or FERPA, governed by HIPAA, the HIPAA privacy rule, or FERPA? Well, school-based health centers and their sponsoring agencies are often covered entities under HIPAA. And if they're covered entities, they must follow the HIPAA privacy rule with respect to students' information that is protected health information. In other words, students' health information that falls within that definition of PHI under HIPAA. But I'm going to start sounding like a broken record here. Education records are excluded from the definition of PHI in the HIPAA privacy rule. So if a school-based health center's records fall within the definition of education records for some reason, then the school-based health center must follow FERPA rather than HIPAA access and disclosure rules. Next slide, please. And how do we determine when records are subject to FERPA? There is excellent joint guidance from the Federal Office of Civil Rights and the Department of Health and Human Services and the Federal Department of Education that was updated fairly recently. It was issued originally in 2008 and updated a couple of years ago. And that joint guidance explains that whether the information or records are subject to HIPAA or FERPA depends on the relationship between the school-based provider and the educational agency. And that's a case-by-case assessment. So we're not going to be able to give you any sort of hard and fast rules in the scope of our 1-hour training today. It's a case-by-case assessment that for which the relevant factors include funding, operational and administrative control, and the specific services and functions that are provided. Next slide, please. So finally, there are some similarities, significant similarities between the HIPAA privacy rule and FERPA. Generally, they both restrict access to records and require written authorization or consent for release of records. And some exceptions under both laws allow disclosure without the need for written authorization or consent. But there are also significant differences. And those largely relate to parent access rules, who must sign an authorization or consent for release, and to opportunities for information exchange that exist under both laws, but who may exchange the information with whom without a written authorization is different. So those are all questions that have to be looked at on a case-by-case basis in specific situations. Next slide. So we have one more poll question about HIPAA and FERPA. It's again a true or false question. If a healthcare provider's records fall under FERPA, they cannot also fall under HIPAA. Is that true or false? You have a few seconds to answer. So about a third of you said that it was true, and about 2/3 of you said that it was false. So let's look at the answer. It's true. The HIPAA definition of protected health information specifically excludes any education records protected by FERPA. And I think that means we're ready to turn to our next federal privacy law, which is 42 CFR Part 2. And Amber's going to talk to us about that.
Yes, thanks, Abigail. We are on to 42 CFR Part 2, which we call Part 2 for short. You can go to the next slide. It is the Federal Substance Use Disorder Privacy Law and Regulations that protect SUD treatment records provided by schools and community-based SUD treatment providers if the records originate at a Part 2 program. And the protections afforded by Part 2 generally follow the information even after it leaves a Part 2 program. So what's this Part 2 program I keep referencing? We can go to the next slide. It is a SUD treatment provider that is both federally assisted and a program. And the terms that you see in quotation marks are explicitly defined in the regulations, but we have some examples here to help you understand. So one example could be an identified SUD counselor in a school clinic whose primary function is providing SUD services. So that meets the definition of a program and has DEA registration, so is federally assisted. Another might be a freestanding opioid treatment program that dispenses methadone. Again, meets both parts of the definition, federally assisted and a program. Next slide. And Part 2 protects any information that identifies someone as seeking or receiving treatment from a Part 2 program. So that's the typical identifiers you might think of, like name, date of birth, social security number, but also that person's diagnosis, their status in treatment, their medications, things like that. And Part 2 protects information in any form, written, verbal, or electronic. So no matter if you fax the information, for example, email it, have a conversation on the phone with someone, or speak to someone face-to-face, that information is protected. And the general rule is that you must have written patient consent. We can go to the next slide. Before disclosing that information. Of course, as with most rules, there are some limited exceptions, but the general rule is that you need written consent before you may disclose. Next slide. So when it comes to minors, Part 2 defers to state law definitions of minors, and state law also dictates whether a minor can consent to their own SUD care without their parent's signature. Generally, Part 2 also requires a minor patient signature even for disclosure to their parents. And again, we see a sort of lengthy exception, but that's the general rule. And for other disclosures, besides disclosures to the parent, whether a parent signature is also required on the form in addition to the minor signature is also a matter of state law. So now we will have a poll question about Part 2, true or false. If a healthcare provider's records fall under FERPA, they cannot also fall under Part 2. A couple more seconds. Okay, I think we can close it. It's like 63% of you answered false, with 37% answering true. Let's go to the next slide. So great. The answer is false. Some school-based SUD providers will be Part 2 programs, so they will be covered by both Part 2 and FERPA. So Part 2 and FERPA are not mutually exclusive like HIPAA and FERPA are. Next slide. And I will hand it back to Abigail to discuss the 21st Century Cures Act.
So thank you, Amber. That was wonderful overview of a very complicated set of regulations, Part 2. We're going to shift gears now and just for a moment talk about the 21st Century Cures Act, which is a much newer law than any of the ones we've previously been discussing. FERPA, the HIPAA privacy rule, and Part 2 have all been on the books for quite a long time. The 21st Century Cures Act was enacted in 2016, but probably was not familiar to many of us until much more recently. The 21st Century Cures Act required the development of rules to improve patient access to and control of their own health data. Any of you who've tried to get copies of medical records in the past may have encountered the fact that even though you were legally entitled to access under the HIPAA privacy rule, it could be a cumbersome, time-consuming, and expensive process. So what the 21st Century Cures Act required was a way of giving patients access to their own electronic health information in a much more streamlined and speedy fashion. The Cures Act also has some rules about exchange of health information and certification of health IT. And this law has had a big impact on patients, on physicians and other healthcare providers, on insurers, payers, technology developers, and stakeholders. And any of you who have a healthcare provider who has a portal, like MyChart or something, have encountered the effects of the 21st Century Cures Act. Next slide, please. So the major way in which we've been impacted or affected by the 21st Century Cures Act is through a rule that became final in 2020. It's referred to as the ONC rule, which stands for Office of National Coordinator for Health Information. And it's a rule with a long name, but the most important aspects of it from our perspective today are that it affects patients' access to electronic health information and indirectly their parents' access to their electronic health information. And it includes a ban on information blocking so that those who are obligated to comply with the ONC rule, which includes most healthcare providers, are not allowed to block access to patients' electronic health information. There are exceptions to this, and there are 8 exceptions, but the 3 that are probably the most important from our perspective today are that there's an exception for preventing harm, an exception for privacy, and an exception for infeasibility. And if you go to the next slide, this just reviews who is obligated to comply with the ONC rule, the information blocking rules, and that includes healthcare providers, health IT developers, and health information networks or exchanges. And if you analyze these requirements carefully, we see that this may apply to some healthcare providers of mental health services in schools. And this is a pretty new law, and it's only really beginning to be well understood how it applies in different situations, but it is rapidly affecting the exchange, disclosure, and access to electronic health information. Next slide. So finally, how does it apply? And I think this is really kind of a way to just repeat the fact that the information blocking rule may apply to student mental health records. And it's because the prohibitions on blocking access to individual health information could affect student mental health records. But because the exceptions include a privacy exception, it's really important to look carefully and determine when patient consent may be required if a stricter privacy rule or law applies, like 42 CFR Part 2. And this is significant for some mental health professionals in school settings. Next slide. And now I'm going to turn it back over to Amber to talk to us about how these laws intersect.
Thanks, Abigail. So now we'll just do a sort of summative review of how these laws intersect and may at times overlap over one another. Again, they work together sometimes and not necessarily preempt each other, but you may find them working together, I guess, in various situations. They don't exist in a silo, so to speak. So they have to be understood in relation to one another. And remember that the HIPAA privacy rule excludes education records that are covered by FERPA from their definition, HIPAA's definition of protected health information. And it defers to state and other laws on whether parents have access when the child is considered the individual, as Abigail discussed earlier, and has consented to their own care. FERPA may potentially give parents access to health information that they would not otherwise have had if HIPAA had applied. But the parent has access, again, because that information is in an education record that they have access to. You can go to the next slide. Part 2 provides certain protections for minors who are authorized to consent for their own SUD care under state law, and also for minors who may not necessarily be able to consent to their own care. Part 2 provides very strict protections for both minors and adults alike. And lastly, the 21st Century Cures Act includes the exception to the ban on information blocking that Abigail just discussed if it's necessary to comply with federal privacy laws like Part 2, for example, or state privacy laws as well. And now I'll turn things over to Dr. Adelschein to give us some more key points.
Thanks, Amber. So we're just going to quickly go through some key points. And I know this has been an amazing amount of information. And, you know, part of what is important to understand is if you're confused about the overlap between these regulations for students and families, know that you're not alone. They're challenging and difficult and complex for all of us. But understanding these regulations can help our students be protected, as well as the school staff, and ultimately help everybody do better, both in terms of treatment, but hopefully also to be academically more successful as well. Let's go to the next slide. So some key points to be thinking about are, it's important to also know your state laws around informed consent and confidentiality. Here we've really just been talking about how the federal laws affect privacy, but the state laws, as you can hear, are really critical, are going to vary by whatever state you're in. It's important when you meet with your students that they understand, you know, who you work for and why it matters in terms of their health information, whether it may fall under FERPA and have an impact in relation to communication with family members or otherwise. And then also, you know, letting the student know up front what information is confidential, who will have access to the visit record becomes really important, so the student has a comfortable sense of what's being shared and there are no surprises for you or the student they're supporting. So it's really important to know your responsibility as to what information to share with the family, when it's appropriate to share it with them and or with the school, depending upon whether you're employed by the school district or whether you're doing a contract with them or whether you're a community provider on site in a school. I know we have lots of questions. We have a little bit of time for them. So let me hand things over to Michael with the one thought that when we come back again in 2 days, we'll be going through some cases that will hopefully address some of these questions as well. Michael. Michael, you're muted.
So sorry, everyone. Thank you, Steve. I am Michael Graziano from the COE-PHI, and as time allows, I'm going to be asking our subject matter experts a couple of commonly asked questions that came into the Q&A pod during today's presentation. Again, due to the number of participants with us today, we won't get to address all of your questions. However, all the questions you submitted today will be reviewed to assist us with learning more about what your specific needs are, so that we can develop and disseminate helpful resources for you going forward. So our first question is for Abigail. We've received several questions about limits on parental access, such as when can a student deny parental access to mental health information in educational records? What are your thoughts about that?
Thank you, Michael. So the question is when a student can deny parents access to mental health information in an educational record. And I somehow accidentally turned off my video when I thought I was turning on my video, but here I am. That's a great question, and it has multiple answers, and I'm not going to be able to give a comprehensive answer, but I can suggest a couple of things to think about. First of all, if the student is, quote, an eligible student, in other words, is 18 years of age or older, then the student is the one whose permission is required to grant access to the information. The second thing is that parents do generally have access to information that is in the education record. So the question would be, what information has to be included from a mental health professional into an educational record? And that's a complex question that would really require some analysis of the state laws as well as the the federal laws. So the short answer is, if it's in the educational record, then the parent would have access to it unless the minor, the student was not a minor, was an eligible student age 18 or older. But some further analysis would be required as to what needs to go into that mental health record.
Thanks, Abigail, for that very thoughtful response. And thank you to our audience members for your very helpful questions. Also a question for Abigail. We've received many questions about when a mental health provider in a school is covered by FERPA or HIPAA. So for example, does FERPA or HIPAA apply to a mental health clinician that works for the school providing mental health services? Do you have any thoughts about that?
Again, I want to say that that's a great question, and it's one that really, if you look at the guidance that came down that was provided by the Department of Education and the Office for Civil Rights on when information is governed by HIPAA and when information is governed by FERPA, their bottom line is it requires a case-by-case assessment in which you have to look at who the mental health professional is employed by, what is the specific relationship between the entity that's employing the mental health professional, and a series of other specific questions that are required for a case-by-case analysis. We will talk about this a little bit more on Thursday when we delve into a couple of the frequently arising case scenarios.
Thank you, Abigail, for that helpful reminder. The next question, I believe, is for both Amber and Abigail. We've received lots of questions about which law applies when a school receives HIPAA-covered records. For example, if we receive a medical note with a diagnosis for an IEP plan, is that information in the school's possession still protected by HIPAA, or is it now FERPA?
I'm going to defer to Amber if she knows the answer to that question. And the reason I'm deferring is that I think that this is a situation in which not only HIPAA or FERPA, but possibly IDEA requirements might have to be considered. And I don't want to answer that, sort of off the cuff in terms of when IDEA might have some additional requirements.
Yeah, I wouldn't know about the applicability of the IDEA either, so I'm sorry about that. I can't answer right now.
Okay. We have time, I think, for one more question. And this could be for Abigail or Dr. Adelsheim. Is a school counselor required to document meetings with students who discuss issues with family and parents? If so, do they have the power or the right to refuse parental access?
I'm going to defer to Steve, Dr. Adelsheim, on this question, because I think it's important that we get a clinician's perspective. In other words, what does a clinician in this situation have to think about when they're deciding what information to document? There are obviously legal implications that they have to take into consideration, but I also think the clinical perspective is important.
Well, as someone who's actually not a school counselor, but has worked with school counselors, my experience has been that many school counselors who will have conversations with students that might involve communication about their parents will at times maybe document that the interview took place and some of the core components without necessarily putting in all their detailed information. Because sometimes I know some school counselors are a bit concerned because their notes might tend to fall then under FERPA as part of an educational record because of how they're inputting them into their system, depending on the school. They're sometimes judicious in the degree of detail that one might include in in the documentation of the visit because of that concern. I think what's really important for us all to think about is how we work closely with our students and ensure the best family communication possible and find ways to support those conversations as much as we possibly can. Again, I have to give a disclaimer as not being a school counselor or a school mental health employee. But that would be, I guess, maybe some of the ways that I would think about it. And when we talk about these issues on Thursday, maybe we could all learn more from each other about responses to this question.
Thank you so much, Dr. Adelsheim. So folks, we're at time. I'm going to turn things over now to my project colleague, Madeline Bavasso, who's going to close us out. Thank you, Madeline.
Hi, everyone. Thank you so much for joining us today. We just want to give you a few quick reminders on how to access the COEPHI and the MHTTC website before you all head out today. So we will be dropping a link to the COEPHI website in the chat. Here you can request technical assistance as well as access many of our resources. We have the resource library listed here as well. Here you can access the MHTTC network. Again, we will be dropping a link to this website in the chat. You can access your training calendars as well as the products and resources catalog. They also have social media, which is plugged in this slide deck. And last but not least, we will be sending out a training evaluation today. And as you guys close your Zoom webinar and you head out of this session, an evaluation will pop up on your screen. Please take about 3 minutes to complete this brief evaluation. You are also able to scan the QR code if you're having issues as well. And we just want to send out a quick reminder that Thursday will be our next session for this two-part series, and that is March 16th, 1 to 2 p.m. Eastern time as well. So here we have the evaluation. Like I said, that will show up on your screen as soon as you close out this webinar as well. We will be sending deck as well as some FAQs from this session to you all. And I hope you guys have a wonderful rest of your day. And thank you so much for joining us.